represent the team to have a presentation regarding to the hepatitis C in Cambodia, mainly on prevalence survey and risk factor in the Sri rural district. So today I'm going to give the presentation on this topic, and my colleague gonna help me to answer the question if you have any question. So before go to why prevalence survey, HCV prevalence survey needed in Cambodia, so I would like to give some background regarding to MSF HCV response in Cambodia. So in 2016, HCV screening and treatment projects was established in Phnom Penh, Cambodia, under collaboration between MSF and Ministry of Health. And last year, 2018, the project was expanded to the Morrisey operational district in Bat Dambong province. At the same time, we conduct the prevalence survey in April and finish in August. So why prevalence survey is needed? Because there is a large-scale prevalence survey of anti-HCV antibody are lacking in general population in Cambodia, and previous prevalence estimate are very high. And also it's also the operational needed to inform the screening and operational strategy for MSF as well Ministry of Health, mainly in the Bat Dambong province, for the expansion to identify who to target for the active case finding. The higher prevalence among those aged 45 years old and older, and also should screening and treatment be adaptive with the pattern of population mobility. So the study objectives is to estimate the seroprevalence and Viraemic prevalence of hepatitis C in Morrisey operational district, in general adult population 18 years old and older, and also the population of 45 years old and older. And also we also to assess the socio-demographic and spectral factor associated with HCV infection, to assess the behavioral risk factor associated with HCV infection, and also to assess the knowledge of the people about HCV transmission and prevention, and also to see about the migration pattern. So there is two ways to measure hepatitis C. So first is seroprevalence that have to be done by the rapid diagnostic test to estimate the population burden ever infected in order to identify who should be targeted for the screening. And the second is a Viraemic prevalence that have to be done by PCR to identify the current infection among those who are seroprevalent, to identify who needed for the treatment. So the prevalence survey here was conducted in Morrisey operational district, Bat Dambong province, with a total population of 300,000 people by 2016. And the design of the study was a multi-stage cluster design with a sample size of 3,600 households and 4,800 individuals. And we also oversampling for those who are the age of 45 years old and older. And the study was conducted for 5 months from April to August. And we got a lot of good support and also the cooperation between from the local authority, from the national until the community level. So who is eligible for this study? So the people or adults from 18 years old and older are eligible for this study. So in this study, we have 147 clusters that have 24 clusters for adults 18 years old and older, and 123 clusters for 45 years old and older. In the map here, you can see the distribution of the 147 that have selected in the Morrisey operational district, Bat Dambong province. For the result, the descriptive result of the survey, we have included around 3,600 households, and also around 5,100 individuals participate in the study with the high response rate of 98 to 99%. And regarding to the age gender characteristic in this survey sample will consist with those of the population of the Morrisey district by consensus of 2016. For the result of socio-demographic survey, we have found that among the participants, 50% of the population have never attended school. That have percentage between men and women are quite similar. And also 31% of population reported low socioeconomic status. And we also found that 54% of population were farmers, that we have found the percentage of men are higher than women. For the migration concern, we found that 28% of population reported being away from home for any length of time within the previous year, and 16% of population was away for 1 month or more than 1 month, which is the definition of the migration in this study. And we found that the high percentage of the migration in the category age group from 18 to 44 years old is higher than 45 years old, 45 and older. So we have found the primary reason that they are absent from home or they do the migration because they find a job. So the information here, the migration information here is very important for the project to design the screening strategy. For the result of seroprevalent and Viraemic prevalent, we found that the overall seroprevalent have a 2.6%, and we have found male are higher than female. And also, if we look at the age, looking at the age group, we have found that 45 years old and older have higher, which is 5.1% higher than the category of age group 18 to 44 years old. And we have the same pattern for the Viraemic prevalent. For the geographic distribution, regarding to this study, we found that there is no clear geographic pattern and also no clear difference between urban and rural area. For the risk factor analysis, for this study, we analyzed just only the population of 45 years old and older. So here is the seroprevalent, and we have found the high prevalence for the older age group, low education, low socioeconomic status. And the last is the routine medical care. It means the past routine medical care, that the people who ever first medical injection, first surgery, first blood transfusion in before 1990, and also those people who have first blood donation before 1980, and those who ever receive dental or gum treatment. If we look at the knowledge of HCV among the participants in the prevalence survey, we have found that 65% of population had never heard about HCV, and 81% have no knowledge about transmission, and 78% of the population had no knowledge about the prevention. So from the result here, you can see that the knowledge about HCV among the population of people in the Model state is very low. So during the study, we have met some limitation. So regarding to the study, because of the history and current pattern of transmission are not described in data, the study described the prevention due to the nature of HCV, and the date of infection is unknown. And the risk factor analysis was limited too, because we analyze just only those who are 45 years old and older. And the result itself also describes just only for the Modusay and Battambang province, and may not represent for the other country or for the national level. So the study, we have a big contribute to Cambodia for it is the first large scale for the prevalence survey on HCV infection in the general population in Cambodia. And it showed the high prevalence in the older age group, also the link between HCV zero infection and in the increased age. And it would be used for the survey result to design the prevention, screening, and treatment activity. In short, the study served as an alert to potentially high HCV prevalence in Cambodia. The result can be used to guide for the national policy discussion, strategic development, and especially for use for the area, the Modusay operational district or in the Battambang province. So finally, we would like to thank you to all study participation and the field staff, and also all collaborators during the our conduct survey in Cambodia. Okay.